Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Loneliness is Killing Your Heart. And trust me, it's juicier than your cousin's peach cobbler. Here's something that'll blow your mind. You could be eating kale like it's going out of style, hitting the gym harder than a Rocky montage, and still be damaging your heart every single day. The culprit? Loneliness. And I'm not being dramatic here. Research shows it's as deadly as smoking 15 cigarettes daily. Yep, entirely true. I can't make this stuff up. Today we're talking about how isolation literally breaks hearts, and I mean that in the most medical way possible. Let me paint you a picture of what loneliness does to your ticker. When you're chronically lonely, your body thinks it's under attack. It triggers inflammation like you're fighting off some medieval plague. Your cortisol levels shoot up faster than gas prices, cranking up your blood pressure and heart rate. It's like having a car alarm going off in your chest 24/7. I tell my patients all the time, loneliness creates the same cardiovascular stress as diabetes or high blood pressure. Your heart doesn't know the difference between running from a bear and sitting alone in your living room scrolling through everyone else's happy photos. Both scenarios make your cardiovascular system think it's time to panic. Let me tell you about Sarah. She's 45, works in accounting, had perfect health metrics. I'm talking textbook perfect. Then she went through a divorce, stopped her social activities, started working from home alone. Within 6 months, this woman showed up in my office with elevated blood pressure and an irregular heartbeat that had me scratching my head. Her diet was cleaner than a whistle, exercise routine tighter than my jeans after Thanksgiving, but something was clearly wrong. Turns out loneliness was the smoking gun. Her recovery didn't start with medication. It started when she joined a hiking group. 2 months later, her numbers were back to normal. The human connection literally healed her heart. Here's the science behind this madness. When your brain perceives social isolation, it flips into survival mode. Think of it like this: back in caveman days, being alone meant you were lion lunch. Your brain hasn't gotten the memo that we've invented door locks in grocery stores, so it keeps that ancient alarm system running, flooding your body with stress hormones that are basically sandpaper for your artery walls. These stress hormones don't just visit and leave, they move in, redecorate, and start causing real damage. They roughen up your artery walls, making them perfect parking spots for plaque buildup. Before you know it, you're looking at increased heart attack risk, and your heart's working overtime like it's trying to pay off student loans. But here's where it gets interesting and hopeful. Social connection literally calms your cardiovascular system down. It's like having a built-in anxiety medication that doesn't come with weird side effects or cost you a fortune. Now, before you panic and start friending everyone on social media, let me drop some wisdom on you. Quality beats quantity every single time. One meaningful relationship, and I mean someone you can actually talk to, not just someone who likes your posts, protects your heart better than dozens of acquaintances. Regular face-to-face interaction can reduce your heart disease risk by 50%. 50%. That's better than most medications I prescribe. Even pet ownership shows measurable cardiovascular benefits. Your dog doesn't judge your bad hair days, and your heart appreciates that unconditional love more than you know. Virtual connections help almost. Don't get me wrong, does she? But they can't completely replace good old-fashioned, in-person human bonding. Your heart needs the real deal. So here's your heart-healthy homework. And yes, I'm giving you an assignment because this is literally life or death stuff. Schedule one in-person social activity this week. Coffee with a friend, a walk with your neighbor, heck, call your sister and actually talk instead of texting. Your heart will thank you. If you're sitting there thinking you don't have anyone to call, maybe I should see you in the clinic. We need to talk. But seriously, start small. Join a class, volunteer somewhere, strike up a conversation at the grocery store. Your cardiovascular system is depending on it. Remember, loneliness isn't just an emotional issue. It's a medical emergency wearing comfortable clothes. Make relationships a prescription for heart health because your ticker needs human connection like it needs oxygen. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all. Later.